Coronary Artery Disease and Its Detrimental Effects by Chrissy Wilhelm. The human heart is a muscular organ roughly the size of a fist, located slightly left of the center of the chest cavity. It consists of 4 chambers, 2 atria on the top and 2 ventricles on the bottom, that work in a coordinated sequence to pump blood throughout the body. Oxygen-poor blood returns from the body to the right atrium and is sent to the right ventricle, and then pumped to the lungs to receive oxygen. The oxygen-rich blood then returns to the left atrium and passes into the left ventricle and is pumped out through the aorta to supply the body. This continuous cycle is critical for delivering oxygen and nutrients to tissues and for removing waste products like carbon dioxide. The heart's muscular walls require a constant supply of oxygen-rich blood to function effectively, which is delivered by the coronary arteries. These arteries branch off from the aorta and wrap around the outside of the heart, feeding the heart with essential nutrients and oxygen. If these arteries become narrowed or blocked, the heart muscle can become deprived of oxygen, leading to a serious consequence. This condition is known as coronary artery disease, or CAD, is a leading cause of morbidity and mortality worldwide. Understanding the structure and function of the heart and the vital role of the coronary arteries helps us grasp the serious impact that CAD can have on the cardiovascular health. Coronary artery disease is a condition in which coronary arteries responsible for supplying oxygen-rich blood to the heart muscle become narrow or blocked due to the buildup of plaque, a process known as atherosclerosis. Plaque is composed of cholesterol, fatty substances, calcium, and other materials found in the blood. Over time, this buildup thickens and hardens, reducing blood flow to the heart. The restricted blood supply can lead to symptoms such as chest pain or angina, shortness of breath, or more severe outcomes like heart attacks when the blood flow is completely obstructed. CAD is the most common type of heart disease and a leading cause of death worldwide. According to the World Health Organization and the Centers for Disease Control and Prevention, millions of people die each year from complications related to coronary artery disease. It affects both men and women and becomes more common with age, though lifestyle factors significantly influence its onset and progression. The widespread prevalence and potential for life-threatening events make CAD a major public health concern, underscoring the need for prevention, early detection, and effective management. The primary cause of coronary artery disease is atherosclerosis, a gradual process in which plaque builds up on the inner walls of the coronary arteries. This plaque is composed of cholesterol, fatty substances, calcium, and cellular waste products. As it accumulates, the arterial walls become thickened and less flexible, leading to a narrowing of the artery and a reduced blood flow to the heart muscle. In some cases, plaque may rupture, causing blood clots to form and further obstruct the artery, potentially resulting in a heart attack or other serious cardiovascular events. Several risk factors contribute to the development and progression of CAD. Non-modifiable risk factors include age, as the risk increases over time, gender, with men generally at higher risk earlier in life, and genetics, where a family history of heart disease raises one's susceptibility. Modifiable risk factors are behaviors and conditions that can be managed to reduce risk. These include smoking, high blood pressure or hypertension, high levels of LDL or your bad cholesterol, obesity, physical inactivity, and poorly controlled diabetes. Addressing these modifiable factors through lifestyle changes and medical treatment is essential in preventing and managing CAD. The pathophysiology of coronary artery disease begins with the buildup of plaque inside the coronary arteries, leading to a narrowing of the arterial lumen. This restricts the flow of oxygen-rich blood to the myocardium, the heart muscle, especially during times of increased demand such as physical activity or emotional stress. As the narrowing worsens, the myocardium becomes increasingly deprived of oxygen, a condition known as myocardial ischemia. This lack of oxygen can cause chest pain, and if prolonged, may result in permanent damage to the heart muscle. A key factor in this process is endothelial dysfunction, which refers to the impaired functioning of the inner lining of blood vessels. Normally, the endothelium helps regulate blood flow and prevents blood clot formation. However, when it's damaged by factors like smoking, high blood pressure, or high cholesterol, it becomes more permeable to lipids and promotes inflammation. Inflammatory cells infiltrate the artery wall and contribute to the growth and instability of plaques. If a plaque becomes unstable and ruptures, it can trigger the formation of a blood clot at the site of the rupture. This clot can suddenly and completely block a coronary artery, leading to a myocardial infarction, heart attack, which can be fatal if not promptly treated. Coronary artery disease commonly presents with symptoms such as chest pain or discomfort, which may feel like pressure, squeezing, or fullness in the chest. This pain can also radiate to the shoulders, arms, neck, or jaw. Other symptoms include shortness of breath, especially during physical activity and fatigue, which results from the heart's reduced ability to pump efficiently due to decreased oxygen supply. However, not all individuals experience noticeable symptoms. In cases of silent ischemia, the heart muscle does not receive enough oxygen, but the person does not feel pain or discomfort. This condition can go undetected for years and significantly increases the risk of heart attack. Several diagnostic tools are used to identify CAD. An electrocardiogram, or ECG, records the electrical activity of the heart and can detect patterns suggesting reduced blood flow or a past heart attack. A stress test evaluates the heart's performance during physical exertion, helping to uncover symptoms or abnormalities that are not present at rest. In more advanced assessments, coronary angiogram is performed by injecting contrast dye into the coronary arteries and taking X-ray images to visualize blockages or narrowing. These diagnostic procedures are critical for early detection and guiding treatment decisions to prevent severe cardiac events. Coronary artery disease has several detrimental effects due to its central problem: reduced oxygen supply to the heart muscle. When the coronary arteries become significantly narrowed or blocked, the heart muscle, the myocardium, receives insufficient oxygen, a condition known as ischemia. Prolonged or severe ischemia can result in death of heart muscle tissue, leading to a myocardial infarction, commonly known as a heart attack. During a heart attack, the affected area of the heart becomes permanently damaged, weakening the heart's ability to function and increasing the risk of complications. Over time, untreated or progressive CAD can lead to heart failure, where the heart becomes too weak to pump blood effectively to meet the body's needs. This can cause symptoms such as fluid retention, shortness of breath, and extreme fatigue. In addition, damaged heart tissue and electrical conduction abnormalities from CAD increase the likelihood of arrhythmias, which are irregular heartbeats that can range from harmless to life-threatening. In severe cases, CAD can result in sudden cardiac death, particularly when the major artery becomes abruptly blocked and the heart goes into a fatal rhythm, like ventricular fibrillation. These outcomes highlight the urgent need for early detection and aggressive management of CAD. Prevention and management of the coronary artery disease rely heavily on making long-term lifestyle changes that reduce risk factors to support heart health. A heart-healthy diet, low in saturated fat, trans fats, and cholesterol and sodium, can help control blood pressure and cholesterol levels. Regular physical activity, such as 30 minutes of moderate exercise most days of the week, improves cardiovascular fitness and helps manage weight. Smoking cessation is one of the most critical steps, as tobacco use significantly accelerates atherosclerosis and damages the endothelium. Managing stress, controlling diabetes, and limiting alcohol consumption are also essential components of preventative care. In addition to lifestyle modification, medications play a central role in CAD management. Statins are prescribed to lower LDL cholesterol and stabilize plaque, while beta blockers help reduce heart rate and blood pressure, decreasing the heart's oxygen damage. Aspirin may be used in low doses to prevent clot formation. More advanced cases, interventional procedures may be necessary. Angioplasty involves inserting a balloon to open a narrowed artery, often followed by the placement of a stent to keep the artery open. In severe or multiple blockages, coronary artery bypass grafting, or CABG, may be performed to reroute blood flow around the blocked artery using vessels from other parts of the body. Combining these treatments with consistent follow-up care offers the best outcomes for individuals with CAD. Patient education plays a vital role in improving outcomes for individuals with coronary artery disease. Educating patients about the importance of early intervention can significantly reduce the risk of severe complications such as heart attacks, heart failure, and sudden cardiac death. When CAD is detected in its early stages, patients have more options for managing the disease through lifestyle changes, medication, and routine monitoring. Early treatment can slow the progression of atherosclerosis, improve quality of life, and prevent irreversible damage to the heart muscle. Furthermore, patients must understand how CAD often coexists with comorbidities like hypertension, diabetes, and obesity, and that controlling these conditions is essential in reducing overall cardiovascular risk. Patient compliance with treatment plans is another critical factor influencing long-term outcomes. Adhering to prescribed medications, attending regular follow-ups, maintaining a heart-healthy lifestyle, and understanding warning signs can help prevent disease progression. When CAD is managed early and effectively, the prognosis is generally favorable, with many individuals maintaining an active and productive life. However, late-stage detection, often after a major cardiac event, is associated with higher risk of complications, reduced heart function, and increased mortality. Therefore, empowering patients through education, supporting them in managing comorbidities, and promoting consistent adherence to treatment are essential strategies for improving prognosis and reducing the burden of CAD. In conclusion, coronary artery disease is a serious cardiovascular condition caused by the buildup of plaque in the coronary arteries, leading to reduced blood flow to the heart muscle. Key aspects of CAD include its development through atherosclerosis, risk factors such as smoking, hypertension, and high cholesterol, and its potential life-threatening consequences like heart attacks, heart failure, and arrhythmias. Diagnosis through tools like ECG, stress tests, and coronary angiography helps identify CAD early, while lifestyle changes, medications, and surgical procedures offer effective management strategies. Recognizing and preventing CAD is crucial to reducing its impact on individuals and public health. Early intervention can significantly improve prognosis and quality of life, especially when combined with efforts to manage conditions. Education plays a central a central role in the process by empowering patients to make informed choices, adhere to treatment plans, and recognize warning signs. By prioritizing patient education and prevention strategies, healthcare providers can reduce the prevalence and severity of CAD, ultimately saving lives and improving long-term health outcomes. For more information on this area, please check out these references.